Hello. Yeah, I'm going to be presenting on medical imaging for undergraduate nursing education before and after the pandemic. I just want to start off and give full credit to Anthony Manning-Stanley, who really spearheaded the whole project and sort of masterminded it. And what I'm about to describe is my contribution is during the teaching of a couple of medical imaging stations that I'll go into shortly. Okay, so I just want to add a bit of context to this. I'm in the School of Health Sciences and I work on the diagnostic radiography program. And we've actually got quite a few disciplines within the School of Health Sciences, such as nursing, physiotherapy, orthotics, and so on. And this collaboration was actually between diagnostic radiography, aka medical imaging, and nursing. Um, so at the moment, we've got this school-wide simulation project. The principal investigator for that is Dr. Pete Bridge, and he was successful in a funding bid from the Office for Students to develop simulation within health sciences. And he's affectionately called the project HIPPOS, Health Science Integrated Professional Placement on Campus Simulation, not a contrived acronym whatsoever, quite a fun one. And the project I'm about to describe, as I say, is one small part of that overarching project that has been put forward as a university submission for the National Collaborative Award for Teaching Excellence to AdvanceHE. So we've got our fingers crossed for that one. So let's turn to medical imaging education for nurses. Now, the nursing lecturers approached us, the nursing team, and they said there's a definite gap within their provision in terms of nurses' education in medical imaging. And what's interesting is that nurses will encounter, while on placement, various medical imaging modalities all the time. So that might be magnetic resonance imaging, MRI scanners, or CT scanners, or ultrasound, or just regular planar X-ray. If anyone's had one of their bones X-rayed, you'd be familiar with that. So there is a gap, and it's as well we know in our program in diagnostic radiography, it's really hard to secure placements in this area. And so what we began to look at pre-pandemic was having a sort of simulated placement, which sounds rather grand, but actually we scaled that back a little bit and turned it into more of a teaching intervention, teaching innovation with simulated activities within it. So a little knowledge in this area can do a lot of good. So let me give you the example of a nurse is potentially escorting an elderly patient to an MRI scanner. And an MRI scanner uses a very strong magnet that's several thousand times stronger than a fridge magnet. And the nurse may be better acquainted with the patient than the radiographers. The radiographers, it's kind of more, in terms of time, quite a short-term relationship they'll have with the patient, whereas the nurse might have a longer-term relationship. And so a little, if they're aware that the patient has a pacemaker and so on, and the patient might have trouble communicating that's something that's useful. And let's face it, multidisciplinary working, moving away from kind of silo mentality will always benefit the patient and will always improve patient safety. Okay, so the interest of time, I'll skip over that. So in terms of methodology, pre-pandemic, we had 4 stations, one on magnetic resonance imaging, one in computed tomography, CT scanner. That's using our CT scanner that's based in the Johnston building on campus. another one X-ray, and again that's using our X-ray room based on campus, and another using ultrasound. So I don't have the time to go through all four of these today, so I just focus on the ultrasound station. And we had about 10 to 15 minutes per station. We were teaching the nurses in small groups, and they were rotating through the various stations. And we gave them a short introductory PowerPoint. It was quite didactic. It was just a straight lecture. And then that was followed by a hands-on demo or simulation. So I'll describe that in a second. And what we decided to do was give them a pre and post quiz using the Socrative software. I don't know if anyone's familiar with that, but it's similar to Kahoot or other online quiz engines as well. And of course, we provided all the students with feedback at the end, so it's all very fair and equitable. So here's just a snapshot of the Socrative quiz. So you can see the style of the questions we were using. We typically give them 4 statements and they'd have to identify which one is true or false. Socrative is a great tool. So going a bit more into the ultrasound station, essentially what we did was after the lecture, we had a practical demo, and the students actually used the portable ultrasound machine to scan phantoms, essentially homemade phantoms in true Blue Peter style. So here you can see a Tupperware tub with gelatin and various objects in there, so you can simulate things like bladders and kidney stones and so on quite well to the level of detail that we need. You can also scan yourself quite safely. So we have the students scan their own carotid arteries, or scan my carotid artery, I should say, using the ultrasound machine. So it's really just to help bring it to life for them. So in the post-pandemic world, we had a bit of a shift. We delivered these sessions online in a synchronous way. And as this wasn't a formal sort of project, we just thought about what's the best way to deliver this. And we settled on having more of a discussion, tutorial style, small group chat, so that we can explore some of the students' preconceptions and misconceptions. And remember, we were just talking at a very basic level. And we use things like animations to spark discussions. So we did use a longer amount of time. This was delivered pre-breakout room facility in Teams. So if anybody remembers those awful days, it was very difficult, and we did actually lose some students while doing the exercise because of that. So here's an example of some of these sorts of animations that we use for discussion. So this is obviously an obstetric scan, and there's the ultrasound machine, their ultrasound probe, and we looked at the emission of pulses, and some of them are reflected back, and that allows you to build up this picture here, much like bats do use echolocation in a cave. So looking at some of the results then, in person, we compared the pre and post test results. We ran the sessions a few times, but if you use the appropriate statistics, paired sample t-test, we found there was a statistically significant improvement in the scores. So here we're getting a post score of about 12, and here a post score of about 13. And what was really interesting was that we got pretty much same results when we conducted it online using this tutorial style method. So we're getting a post score of about 12.5. So the results were very similar. So yeah, that was an interesting result, that we're getting similar scores between the tutorial style type of teaching and the in-person, slightly more didactic half of it. lecture style, but also incorporating hands-on simulation activities. And of course, where we are now is that, of course, we gradually we're unlocking, and of course, we live in a world of uncertainty, in a post-pandemic world. Who knows what's going to be needed? So this was nice to see that we can get both methods are going to be as effective. Now, we did have some plans to put together a training package, sort of open university style, kind of asynchronous distance learning package. But reflecting on the study here, we're thinking of, just based on our experiences with the teaching, that this might be less useful, and it may be more useful to have something along the lines of in-person demos, or sort of more active learning based around tutorials, or even looking ahead to problem-based learning. So moving forward then, we're working with the nursing team to integrate medical imaging as part of the nursing undergraduate course. And that's just to say thanks very much for listening, and I'll be delighted to answer any questions you might have.
Okay, thank you very much, Dean. That was really interesting. Do we have any questions? Feel free to type them in the chat. Just while we're waiting to see if there's any questions come through, Dean, I've got a couple if that's okay.
Oh, please, yeah.
So I know you said that the scores kind of didn't really differ from the face-to-face to more online, but how did the students react initially? Were they quite tentative, moving more online, or were they quite open straight away? Or
I think what was interesting was that in person, with a more didactic style, they were quite difficult to. It was difficult to open them up for
yeah,
discussion. Uh, and to be fair, we didn't give them much opportunity to, because we just kind of dived into the we say the ultrasound station. We put the
yeah,
ultrasound probe in their hand, and they were a bit not particularly forthcoming, because I guess they hadn't really got comfortable. They'd only met me,
yeah,
known me for 5 minutes before I'm shoving an ultrasound probe into the hand and telling them to go ahead and start scanning. So the tutorial style, we took a bit longer. Obviously, there's time to build up rapport with the students.
yeah,
So in fact, I'd say they were more comfortable um, online, and it'd be really interesting to see if it could be even more effective replicating that style in person.
yeah. I think sometimes students they feel a lot more comfortable in their own environment, don't they? And maybe
Mm,
online gives them a bit of time to kind of be more reflective and think a little bit more about the theory rather than diving into the hands-on. So
mm.
maybe that helps them kind of join more dots together.
Yeah, it's a good
But
point.
that's really interesting, yeah. I think Catherine's typing a message. She's put, "Do you think this approach could increase more interprofessional learning?"
Yes, we've got a huge IPL program in the School of Health Sciences. It's something we're very passionate about, and essentially, this is all about communication. This is, as I said in the beginning, getting professions to work outside of the silos and just communicate with the other professions. So I gave that example. I wanted to give something a bit, concrete, that nurse maybe could have a quick chat with a radiographer and say, look, this patient's not very, it won't be able to communicate very clearly. They just want to reinforce they do have a pacemaker, and these things are written down, but they do get missed, and it's all based around communication. So
Yeah,
that's a really good point, Catherine. That's exactly what we're hoping to do.
great. Okay, thank you.